June is Alzheimer's and Brain Awareness Month. As you can see, I'm wearing purple, so is Nick. We are all here in support of the nearly 7 million Americans who are living with Alzheimer's disease. It's debilitating. The Alzheimer's Association is encouraging you to take charge of your brain health because brain changes that cause Alzheimer's can appear up to 20 years before symptoms really start to show up. So, on the longest day, the summer solstice, today, Alzheimer's advocates are using the light to drive out the darkness of Alzheimer's. Joining us now is Markie Moreno, Senior Director in Care and Support for the Alzheimer's Association. I'm so grateful that you're joining us this morning. I want to have a really honest conversation with you because we talk so much about medications and breakthroughs, but can we also focus on prevention this morning?
Absolutely. Good morning, Elizabeth. Nice to be with you today. And thanks for wearing the purple. Alzheimer's disease is a fatal and progressive brain disease, and it affects a person's memory, thinking, and reasoning, and ultimately their ability to function. It is the leading cause of dementia and really accounts for approximately anywhere from 60 to 80% of all dementias. And as you mentioned, changes in the brain start to occur 20 years or more before you can actually start seeing these symptoms. Now, we know that age is the greatest risk factor for developing Alzheimer's, but it is not a normal part of aging. And I think that's something that people think normally happens as we age. Today there are more than 7 million or nearly 7 million Americans who are living with Alzheimer's disease, and the majority of them, 2/3, are women. We also know that African Americans are twice as likely to develop Alzheimer's disease, and Hispanics are 1.5 times more likely to develop the disease. So, thinking about what can we do to actually minimize our risk for developing Alzheimer's or other forms of dementia, it's really critically important to learn more about what are some of the lifestyle factors that people can change as far as eating a low-fat diet, getting good sleep, not drinking a lot of alcohol, staying socially engaged. All of these things, research is really starting to show that if we do these things, we can actually start to minimize our risk of developing Alzheimer's.
And you listed some of those at-risk women, and you mentioned African Americans and a number of other instances, but it's not inevitable. So it's not something that we should anticipate. So what can we do? What are the early signs, and what can people do today? Even 10%, even incremental changes.
Yeah, absolutely. So, one of the things, I've had the opportunity at the Alzheimer's Association to work with a lot of families who have been impacted by this disease and those who've been diagnosed. And when you start to experience symptoms that are going to interfere or starting to interfere with daily life, this is when you need to be concerned. I always use these two really great examples. I had talked with a woman who had been diagnosed with Alzheimer's, and she was the vice president at a bank. And one morning when she was trying to help her grandsons do simple math, she couldn't figure out the math problem. There was also an award-winning chef who woke up one morning and was not able to figure out the steps of how to make a simple omelet. So I think what's really important for your viewers is to understand that these symptoms really appear and are unique to each person. Every person goes through these symptoms and the disease in their own unique way. And so for myself, I've never been great at math, so to have problems with math is not significant changes for me. But if it was something else that I was able to do, on a normal basis and didn't have trouble with, that could be an indication that something more serious is going on. And it's critically important to see your doctor, share the concerns of the changes that you're seeing, and get an evaluation. The reality is that there are other things that can mimic symptoms of dementia, such as thyroid issues, urinary tract infections, change in medication, depression, and all of these things are treatable. So to be able to see the doctor, share those concerns, and get that evaluation is really critically important.
All right, Markie, I wish we had more time. You were wonderful. But as I let you go, and I will take the last word, I'd be remiss if I didn't mention that caretakers are heroes, right? And they're out there, and there are millions of them. So I want to draw some attention to them today as well.
Thanks for watching, everybody. Go to joinnn.com to find NewsNation on your television provider. Also, don't forget to click that red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.